Good afternoon, everyone. Welcome and thank you for joining us today. Today is August 23rd, 2023, Wednesday, and we are here for a work session with our Human and Economic Health Service Director, Laura Walker. And we're going to be talking about lots of different topics, so I'm going to let her kind of share with us. But I welcome you all. I am Larimer County Commissioner Jody Shai-McNally, Chair of the Board of County Commissioners. Joining me today are my colleagues, Larimer County Commissioner Kristen Stevens and Larimer County Commissioner John Kafals will be back with us momentarily. We also are joined with our county manager, Lorenda Volker, and our assistant county manager, Lori Kadrich. We also have a lot of folks and staff in the audience, but I will let them kind of get introduced as we go forward. So first, we'll just have Laura Walker, our Director of Human and Economic Services, to come and introduce what we're talking about today and introduce our first speakers. Thank you.
Thank you, Commissioner. So I am Laura Walker, and I serve as the Human and Economic Health Service Area Director for the county. And this is one of our quarterly opportunities to come before the Board of County Commissioners and just give some updates about things that are happening in this service area. There's a lot of diversity in the programs, but there's also a lot of connections across the 5 departments that constitute this service area. And so a couple of the things that we really like to highlight when we come to these meetings are innovative partnerships that we're finding either within the service area, across to other county services and programs, but also out into the community. And also any new programs that we're launching or have launched recently and now have some outcomes to share with the board about that new work. And so we have 3 of those examples to talk with you about today. We should have plenty of time for questions, and so I would invite, because we have 3 different speakers for the 3 topics, certainly let the board and our county manager, if needed, ask questions as we go along, just so that those folks that are presenting are up here at the table to respond right away. So with that, I would like to turn it over to Aaliyah Rodriguez. She works directly in my office, and she serves as our Housing Stability Program Manager for the county. And she is here with Amy White from Community Development, and I'm going to let them launch the first topic. Thank you.
Thank you. Just give me a moment. I'm trying to get the presentation up on screen here. Sorry for the blinking lights. Let's see.
Technology is not, sometimes it's not our friend.
The commissioners do have a hard copy of the presentation in front of them, so if these technical difficulties are not resolved pretty quickly here, we can certainly proceed and have you follow along with the hard copies that you were provided.
Sure. I didn't know, Lorenda, if they should go ahead and maybe have it go up and down and start over, or do you think it's just the connection for the computer?
It's what it is we have a large monitor or 2 monitors in front of us, and sometimes if we have the wrong screen code selected, it's more difficult here on the laptop to make it work. So the flashing is the plug, and then displaying the other view.
Okay.
We're going to have to provide some instruction, I think. I don't know how to do it either.
Okay.
Yeah.
And I'm no help either.
Okay, sounds good. Let's respect everyone's time, and if you don't mind having that hard copy in front of you, we'll just go through that way.
Thank you, Aaliyah. Appreciate it.
All right. Thank you for having me. Again, I'm Aaliyah Rodriguez, and I'm the Housing Stability Program Manager. And I'm joined today by Amy White.
And I'm Amy White, Code Compliance Supervisor.
And we're excited to be here, and we're going to just provide an update about the work that we've been doing in the Larimer County Mobile Home Park space. We've been working towards providing educational events. A little bit of background as to what brought us to today. In 2021, Community Development conducted some community-wide surveys, and the results from those surveys said that the residents of our parks wanted more education around building code compliance and permits. And so in 2022, I started working with the Community Development Department to help strategize how to do that outreach and bring that education to the parks. Amy, did you want to add anything more on that?
Not at this time.
Okay, great. So the events that we'll be talking about, we've completed 5 this year. The first is at Mivos, and I'm going to get into a little more detail around these. We had 2 events at Nueva Vida and 2 events at Collins Air. And those are both, with Nueva Vida is located in our GMA with City of Fort Collins, and Collins Air is located in unincorporated Larimer County. So our first event was at Mivos. This was our first step because what Mivos is a leadership development program run by the Family Center. And the participants of that program are leaders from various mobile home parks in our community. And the purpose of it is to provide them with leadership skills and help them become advocates for their communities. So we felt this would be a great first step into the mobile home parks to present the code compliance presentation and education and get feedback around what's important to the communities, what they want to learn more about. That event was on January 17th, and Amy and her team presented.
Yep, so Chief Building Official Eric Fried and myself put together a slideshow. Mostly what we were trying to get people to understand is when they need permits in the parks, and also to identify life safety issues in the parks. There's a lot of carports, there's a lot of steps, there's a lot of additions, and if they've put an addition over an egress window, that's a problem that creates a life safety issue. So those were what we were looking for. Aaliyah, Eric, and I went out in late December, I think, or early December to kind of go through the parks to see what we were dealing with as far as, is it 50% of these that have illegal additions or whatever? And it turns out that it was more like 75 to 80% of them, depending on the park. So we did a little bit of research that way. Mivos, the folks there were very much interested and thought that it would be a good idea for us to go to their individual mobile home communities and provide this information.
So after Mivos, we started a partnership with City of Fort Collins. We were approached by City of Fort Collins. They do regular resource and cleanup fairs for the parks within City of Fort Collins. And they wanted to partner with us on Nueva Vida as one of the parks that's in the GMA. We thought we took it, it was a great opportunity to learn what they do to see if we could replicate it in our county parks as well. To start with, we did a more intimate educational meeting at Nueva Vida for the residents during one of their community meetings on May 8th. That was a chance to just present the information in a more intimate setting, but it was also a chance to introduce staff that are going to be at the fair so that it could start building that trust. Because we didn't want to come into these communities, demanding compliance or anything along those lines. We wanted to educate and give resources to help encourage that compliance and change. So that was on May 8th. And then, did you want to speak to
I was just going to say, there were probably about 30 people, which we thought was a pretty good turnout. There were translation services available, and it was very interesting and very well accepted. People wanted to know what information was being provided. They just didn't know how to get it, so.
Yeah, definitely. Following that was the actual resource fair, which was on May 13th from noon to 3. And then the next couple slides are some photographs from the event. The first one there is just an overview, so it's just, a screenshotted view of Nueva Vida and how the event went. There were 2 pieces to it. There was cleanup, which was primarily run by the City of Fort Collins, and then there were all the resources that were there for the residents to access. The key successes from the fair, there were over 230 residents who attended. There's 68 lots at Nueva Vida. So We had very, very good attendance to the fair. It was really great to see the whole community come out. There were 17 community partners that participated in the resource fair piece. This also gave us a chance to look at our documents that building code and compliance are handing out to the public, and we were able to get those translated into Spanish before the event, so that we can create greater access to pertinent documents that they need to complete. There was immediate shift in resident satisfaction of their park. Some quotes from after the fair was just night and day difference that they felt after being able to have access to the dumpsters and then also general resources. So the next photos here are those booths. So on the 8th slide, you can see that's Little Shop of Physics was there to help entertain the kiddos as the parents were walking around and accessing resources. The picture next to that is the code compliance booth where we were sitting there and passing out paperwork and answering questions as residents came. It was really great to do that prior meeting because residents were able to come to this booth with more specific questions to their situation. The next photo there on slide 9, that's the cleanup details. So these are all the things that were disposed of during this day. 8 30-yard dumpsters, 1 15-yard green waste, 17 mattresses, 4 fridges, 9 AC units, and 9 TVs. So again, this park is 68 lots. So you can understand that night and day difference that they experienced from being able to get all of that rubbish out. And then the next slide there, again, Poudre Library was one of the resources. There was a food truck provided. It was really a nice community event where they were all coming out. That last slide there is 2 more. You can see City of Fort Collins Utilities, another Larimer County booth.
And Amy, I saw that you were looking like you wanted to add something, or?
I did, but I can't remember what it was.
Well, if you remember, let me know. I saw you like, and I'm like, oh, I gotta see if she wanted.
It's good. Leah's doing a great job.
Oh, she is a good job. I thought, oh, did you what? I do that all the time. It's like, oh, what was I gonna say? So, I'm sorry, Leah, go ahead.
That's okay. So that's kind of wraps up the Nueva Vida Resource Fair. Shortly after that one was completed, or even maybe right before it actually happened, we were approached by Collins Air, which is another mobile home park. And this one was a little bit different because they have new management, and the park management actually wanted to host a resource fair and cleanup. Their new park management noticed a lot of issues with some of the mobile homes in the park and wanted to address it. Again, the same kind of way we were approaching it. He wanted to give the opportunity for corrections, the education, and the resources for the residents to better their park. So he approached us and also other community partners to just be part of the resource fair. This one was a little different in that they did the cleanup the whole week beforehand, and then the resource fair was its own thing. So the benefit of that is we saw a lot more people. We were able to connect with a lot more residents. And again, this was a bigger park. So Collins Air has 328 lots in it. So it's a much larger park. We saw a very large turnout. I don't have as many numbers on this one since it was the park that hosted it. And again, like Nueva Vida, we did do that pre-education event, which had about 30 resident attendees. Lots of great conversations happened. I wasn't able to attend that one. So.
Yeah, it was well received. It took a little bit for folks to come around and kind of interact with the booths. Mm-hmm. And as you can see in that picture there, one of the gals up in our building permit techs thought we needed to give something away to kind of entice folks. And so we came up with tape measures that has Larimer County building and code compliance on it. So those were well received, and we also handed those out at the county fair at the county booth down there. So, yeah.
Yeah, I saw those, and
Yeah.
I thought, well, that's unusual. Now I know the story,
Yeah.
so that makes sense. Thank you.
Yep, that was Eric and myself.
They were very popular.
Yes.
Let's see.
I remembered what I was going to say. I wanted to let you all know that we're not starting code compliance cases on all of these as well, right? We're going to give them a little bit of a reprieve educational period to kind of come into compliance. On the life safety ones, obviously those take a little bit more, but we're not starting code compliance cases on any of these. So just wanted to make that clear.
I think another benefit that we saw from these fairs was not only being able to connect with the residents, but connecting with other community resources. Our departments were able to do that. There were several residents that came to our booth with a long list of questions of how do I address this, that, or the other, and we were able to connect them, like with Larimer Home Improvement Program. They were able to fill that application out that day, and they were able to start making some positive change towards.
And even some of the building department staff would actually go look at specific instances where they would say, do I need a permit in this particular case? So I think we looked at like 5 or 6 different specific mobile homes.
Which really speaks to the trust that's being built.
Yeah.
The residents were able to walk up, ask for county staff, can you please come look at my home, tell me what's wrong with it, and then I'll be able to take the steps to move forward. The next slide, again, is just kind of an overview of the actual park, so it's just a map there. And then looking forward, we hope to continue that engagement. We were contacted by City of Fort Collins to hopefully do another joint fair and another GMA mobile home park in spring of summer of next year as well. So hopefully we'll be able to continue.
Yeah, and even if we don't have the resource fair part of it, we're hoping starting in the fall to reach out just to the managers of the mobile homes, just to do the educational piece, which was so well received, so.
Well, phenomenal work, excellent presentation, and great to hear about the trust being built, but it's great that, you were able to have staff there, and thank you to all the staff that participated, because this is above and beyond duties that they assigned, so being out there to go out and look at homes and help educate, I really love that approach.
Yeah.
And the resource fair, were they the same resource fair, the same partners at each one, or a little different? Okay.
They were a little different because the city of Fort Collins was engaged in the Nueva Vida, but not so much in Collins Air.
Yeah.
Yeah, because of the GMA. And further to what Laura said, we were also collaborated with Human Resources, who has the contract for the translation services. So they were built into this as well. So it's really been fun to see how many different departments can actually help benefit these communities.
Phenomenal. I'm sure my colleagues have comments and questions. I'll make my comments afterwards. Commissioner Kafalis.
Thank you, Madam Chair, and thank you, colleagues, and good afternoon, everyone. I have a few questions, and I concur. This is really a great update. Thank you for the work. I think it's really valuable and important, so much gratitude for your work. Questions that I can remember, I didn't write them down. The first one is, what level of coordination are you folks doing with our community outreach folks? Jalitza specifically regarding, because, it looks like the people are going to start inviting us to some of the, like Hickory Village, and I want to know what level of coordination is occurring, so we're all aware of what each is doing. We're integrating as much as possible. That's my first question.
So I can answer that a little bit. I was just visiting with Laura. There's the new outreach coordination, the community engagement group that's being put together. And there's people from the health department, Department of Natural Resources, and they're just different different departments that are trying to, if you know of a place where we can plug in and give some more information on that. And so I just attended their first meeting a couple weeks ago, and as I was there, I was thinking Aaliyah would be a great person to plug into that as well. Just to get out into the fairs and the Pooter Fest that they just had. There were a bunch that went up to that. And at the Nueva Vida engagement, we were surprised to see other county departments there as well, which is how I got plugged into the community engagement group.
May I follow up?
Yes, please.
What is this community engagement group? Is this through the city of Fort Collins?
It's through the county, and it was started by a gal by the name of Jordan Dunn. And again, I'm not sure on the background, Commissioner, but I know Jalitza's a part of it. Office of Emergency Management was there. Michelle Bird is aware of it, and I think it's being sponsored by Michelle. Do you know?
I think that's right. It's one of her projects.
Yeah. So it's just getting off the ground, and I think there's a lot of improvement and a lot of opportunities there for everybody to kind of plug in together.
Well, that's great news, and as appropriate, it'd be nice to know more about that, since, at least for me, that I'm not aware of this new effort, which I think is great. A couple more questions. One is, I appreciate Amy bringing up about the code compliance. We're not going to go after that, but I'm wondering, as part of the resource fair, two questions. One is, are there any resources out there to help folks with some of the financial burden of getting their additions or whatever, especially life safety issues, getting them up to code? That's one question. The second question related to that is, did we have folks there from the Larimer Home Improvement Program who could explain about what's available through that program for energy efficiency of their mobile homes and other things, to make them more accessible, perhaps? Two questions there.
Great questions, thank you. So the Larimer Home Improvement Program is the resource for people to make safety repairs on their mobile homes, and they were present at the fair. So like I said, there was a lot of collaboration where a resident could come and ask us a question, and I could hear what they were needing and whether or not it would be a good fit for the home improvement program, and then walk them over to that booth to fill out an application that day.
And so related to that, we do have, through our Conservation Corps, folks who go out and do energy audits and things of that nature, and I think can actually help make a home more energy efficient. Is that a resource that was made available to folks, or they were informed of it?
I don't remember them having a booth or being available, but we can definitely add that to the list for future.
Thank you. Just, I think one or two more questions, checking with Laura, or I should check with the chair, I suppose.
Yep.
Are there plans to go out to Poudre Valley Mobile Home Park, which has 400 homes there?
So that's that's on the very short list of the parks that we're looking at to partner with City of Fort Collins on for the spring, summer 2024.
And I presume we'll have a presence at the La Familia Fiesta on September 23rd?
That's the first I'm hearing of that fair, but we can work on having a
We're
presence.
communicating and learning from each other.
Yes, thank you.
I had another question, but darn, I forgot what it was.
You keep looking at me when you say that.
Thank you, Commissioner. Commissioner Stevens, did you have comments or questions? Thank you.
Yeah, I think that the La Familia event is more of a fundraiser, less of a fair, so.
Yeah, that's what I thought too.
So I'm not sure, but we can contact Gloria and find out.
We can look into it.
But it might be a good way to connect with people, or at least have some kind of informational pamphlet there for people to take. This is a great program. Thank you so much for doing this. I think this is great work. I'm glad we're partnering with the City of Fort Collins. I think the more people we can partner with, the better. I like when John was talking about conservation, I think that that's really good, especially because in outside the city has a lot of resources, like I'm sure utilities goes, and then they give away the light bulbs and, kind of different things. But I think it would be great if Conservation Corps was there as well. I know that when I was on the Poudre Fire Authority Board, we had a program where firefighters went out with social workers and put in smoke detectors and carbon monoxide detectors. And it was such a phenomenal program, and it was really successful because then there could be this sort of well check, especially for people who were older and maybe didn't get out of their house as much. It was this combination kind of thing. So I think, we can take care of a lot of people's needs and concerns and help them get resources. So, in fact, the program at PFA was so popular that Sweden came and took a look at the program. So, I think that, as we as we think about going into other parks, we can really think about how we expand it, not making it too big that it feels too unwieldy, but just that, wow, there's a lot of opportunity to connect with people. And I really like what you said about people, about building that trust, because I think that, sometimes there's a mistrust of government. And this is really a great way to build trust and have people understand that we actually want to help them. And thank you, Amy, for explaining that we're not really, this is a learning environment. It's not we're not looking to penalize people, but I'm glad that people felt comfortable coming forward and asking, what kind of improvements that they could make. And in that regard, what kind of improvements were people wanting to make? So is it carports? Is it sort of extra shed space? What are people looking for the most?
Carports mostly, and then there's issues with setbacks, and we've got diagrams of how close things can be together if it's covered or uncovered. So it does get a little technical, but mostly carports, some illegal additions that they thought might, after they heard what we had to say about the egress and all of that, they were concerned about that. And I should say that we've also had an increase in folks coming into the office as well as a follow-up. So they may not need something right away on that day, but we have noticed an increase in Spanish-speaking folks coming into the department. So if it wasn't an immediate, it was also a follow-up, and it's now in their brain, so.
That's great. And when Commissioner Cafalas was talking about dollars for people to be able to access, I know that the City of Fort Collins, I think through Neighborhood Services, has a small grant program. Does that extend to people that live in the growth management area?
No, most of the city's resources have to be within the city.
It would be interesting to see what it might be like to seed a small program, initially. Because I remember when I had been in the mobile home parks, a person had showed me a picture, and then I saw it with my own eyes, of a tree that was about to fall into a park and had been chained so it wouldn't fall into their mobile home and destroy their home. And that, I think, helped kind of make the case that, and the park owner said that's your responsibility, even though people really don't own the land, and so technically don't own the trees. And so there was a lot of questioning about that. They said, you need to call the tree surgeon. Well, everybody knows that that's really expensive and a cost that a lot of people can't bear. And so I think that was the genesis of the funding. And so was these real big life safety issues that park owners weren't always taking care of. And so I think that might have even been something that we had talked about in one of your plans. Mm-hmm. So I'd be interested in finding a little bit about how Fort Collins, how much money, do people access that? How much money have they given out? What does it look like? Even to have a small program that would address maybe the most egregious problems that people are having. And I know in tandem with that we had been working with City of Fort Collins and used some ARPA dollars on some of the water quality issues, which is also a really big concern. So all that to say, thank you, good work, let's keep going and see what we can do in the future.
Thank you, Commissioner. I want to echo a lot of what Commissioner Stevens says. Of course, I said just fantastic, just building trust and connection and relationships for the county, and trying to have that kind of rapport is really important, because then they'll also go tell their coworkers and other folks. It kind of ripples out. So I'm just curious, when we have these kind of resource fairs, what kind of budget is it, and where does that come from? And the only reason I'm asking is if we want to continue this, where does it come from? Where does it go? What does that look like? Because I think when we understand when we talk about resource fairs, it seems like it's has expenses, but I'm just curious about that. And if it's a shared, with the City of Fort Collins, I'm assuming it's shared. But since I tried to rent a food truck the other day, I have a little idea about those things. But food is a way to bring people together, so just curious about that.
Go ahead. You
Yep.
have the numbers.
So I do have a more detailed report out of the Nueva Vida event. If the three of you would be interested, I'm happy to email that to you after the fact. But the anticipated budget for the event was just under $9,000, and the actual cost ended up around $11,400. The Nueva Vida event was fully covered by City of Fort Collins, but that was with the understanding that we would assist in a future event, which is the one we're trying to plan for next year, and that budget.
So that came out of the building fund, because it's directly related to buildings. So we had offered to help with some of that funding, but right now that's coming out of the building.
That's great, and that's a lot cheaper than I thought, so that's phenomenal. That's great use of resources. And also, of course, I'm going to ask the same question I used to ask is, mobile home parks in the southern part of the county, I'm assuming will expand to other parts, like Lago Vista or maybe some others. And even the one, partnering with City of Loveland, even that one that's down off of Wilson and 402, or West 14th. I've walked that neighborhood a few times, and so just, I know it's kind of hidden there, and I just know there's some in there that maybe could use a little assistance, so.
Yeah, I think where this collaboration has worked so well is Aaliyah's an awesome person, but she has that mobile home background, right? And Eric and I have been thinking about doing this for years. We just didn't know how to connect and how to get into these communities. And so it's really been a partnership with Aaliyah's knowledge versus what we want the educational piece to be. So it's our first year. We didn't really know what we were doing, and we're going to definitely build on it. And we appreciate all the suggestions. You all probably have tapped into that much more than we are. So if there's something that comes up, let us know.
Great. And the last question I have, if we want to continue this and expand it, because I think this is really important, because like you said, we're not trying to do gotchas, we're trying to help educate and support people to come into compliance, because that's kind of what we're trying, it's because these are health, safety, welfare issues, right? And so this is really important for a lot of folks. I'm curious about when we get to dealing with older adults, which is also another thing for me. And the reason I say that, because my mother, I'm still kind of caregiving, and it's been a big deal for her, trying to understand her rights as a HOA, because, long story I'll share another day, but it would be, helping them understand or getting the help they're supposed to be getting and they're not, but they're afraid to make trouble and understanding their rights and some things. Is that something that maybe we could look at, maybe partnering with, I don't know if Office on Aging was there, but how we can partner to kind of expand in some of those areas that we know. There's some neighborhoods that are not maybe mobile home parks, but are duplexes that are kind of senior living areas that maybe don't know their rights with those kind of groups, things.
So totally separate from this program, the code compliance team recently met with the Adult Protective Services Group. It was amazing how many of the same properties we were dealing with. So we now have partnered with them as well to say, hey, when you're at a property and you see this, if there's wiring hanging from the ceiling or whatever, contact us, and vice versa. If you see this, that somebody might be living in a shed that may not have been permitted and is a life safety. So we've reached out separately to that group as well, and have actually been in touch with them a couple times.
That's phenomenal, and I'm glad you say that, because, sometimes those folks feel so isolated and felt so alone. So just brainstorming, when you said that, the first thing I thought is them contacting you, and I'm thinking we partner with Meals on Wheels, because those people go every day and deliver meals, and they might see things unsafe with a home, and they do well checks. That might be another, if they don't, maybe if those drivers know that this is something we can contact us, maybe we can help somebody instead of like, oh, I might get them in trouble. I think that might be another way to make some connections to help some of our older adults who are, probably feeling, oh my gosh, is it medication, food, or what, right? And so I think that might be one more connection. I just think this is phenomenal. Well done, Aaliyah. Fantastic work, and helping the partnership. And like you said, you had this idea for a long time, and then Aaliyah helped kind of be a catalyst for helping it go. I think it's fantastic, and I just want to commend you and your whole team for just a job well done. It's heartening for me to know this is outreach, and this will be ripple through effects for a long time. So just well done. I look forward to supporting this going on. So, Lorena, would you like to add anything? Because I've seen you've been taking some notes as we've been.
I think I'm really impressed with the educational approach. I think that is a fabulous approach to these kind of situations. Education, help, putting the resources in place to do the cleanup, opening the door in a friendly way that makes folks feel welcome to come into this building and ask questions to get more information, because we do want everyone to live safely and make sure they have the resources to do that. So I'm just really appreciative of it seems simple, but it's not something we've ever done before. And
Yeah.
so thinking outside the box and really approaching a community in a way that meets their needs, it's really great work.
Thanks.
Truly meeting people where they're at, right?
Yep.
So, yeah.
So maybe a follow-up in 6 months or whatever with some of these different ideas to see what we've gathered.
Yeah, well, Caitlin keeps a running list for me of potential topics for these meetings, and so we'll do a future check-in, so.
Thank you.
Thank you both, and thank you for everyone who's connected and helped with this, and thank you to our partners at the City of Fort Collins for a fantastic collaboration.
And Amy gave me the perfect segue also, because our next topic that we wanted to give you an update on today is something that you heard about a year ago, I think is when we had Carol Salter from our Economic and Workforce Development Department come and speak with you about the project that she was initiating. Mark Johnston, our interim director of that department, is delivering his eldest off to college. So otherwise, Mark would have been here today, but this is an auspicious time for his family. But Evan Wendland, who runs our economic development portion of that department, is here for support as well. So if there are questions, you might have to come up to the table, but
I said, Carol, this is your show. I want all the spotlight on you, that I'm here if you needed me.
absolutely.
And she said, I got this.
I think Carol does have this, so I'd like to turn it over to Carol Salter and have her give you an update on the work that she's been doing in the community.
Yeah, thank you. Welcome, Carol. So lovely to see you. So thank you, and Evan and Kaylin, but nice to see you both. But Carol, it's really a pleasure to see you, so thank you.
Well, thank you, Commissioner. It's a pleasure to be here, and thank you so much for the
Sorry about that.
That's okay.
That's okay.
Better, thank you.
Thanks. All right, we'll get started. I'm Carol Salter. I'm with Larimer County Economic and Workforce Development. My role is Nursing Shortage Program Manager, and again, it's a delight to be here. So before we get started, I have a little quiz for you. Of all the nursing jobs, what do you think is the #1 unhappiest nurse job? What would be your guess? Commissioner Stevens?
I don't know, nursing home?
McNally?
Only because I hear about this every week, emergency rooms.
Okay. Commissioner Gonzalez, what do you
couldn't-
think is the most unhappy nursing?
To the question, I couldn't hear the responses that my colleagues gave.
Oh, I'm sorry. One said
Like
long-term.
working in long-term care and nursing homes.
Maybe ICU.
Okay. The #1 unhappiest nurse job is school nurse. Who knew that? So I was very surprised to see that. Hospital staff nurse #2, emergency room #3. So on the happiest nursing jobs, I won't make you guess, the top 3, outpatient case management, office nurse, and NICU nurse are the happiest nursing jobs that we have. So I thought that was just a little bit of interest in that. So nursing shortage, what nursing shortage? Incredible Health interviewed 100 health system leadership to talk about what's going on with staffing with the nursing shortage. And with this, many of the leadership of these health systems recognize, obviously, that there is a nursing shortage, and how they're dealing with it is sign-on bonuses, salary increases, and trying to increase patient ratios. But really, what our nurses want is flexible scheduling, and we're going to talk a little bit about that. So what do the numbers say? And you have the presentation there in front of you. Within the next 4 years, we have about 900,000 nurses that plan to leave healthcare throughout our country. Of that 600,000, they cite stress and burnout as the reason why they're leaving, and 200,000 of those are under the age of 40, and that's what concerns me the most because that's our pipeline. We're seeing nurses in greater number younger that are leaving healthcare. Yes, stress, yes, burnout, but their number one reason is flexibility. They can't work when they want to work, where they want to work, and so they're leaving in large numbers, which is very distressing. They also looked at LPNs. It's interesting. I've been in healthcare a long time, and I remember when LPNs were kind of walked out of the hospital, and now the hospitals are bringing them back in just because of staffing shortages. And even in that demographic, we have about 30,000 that have left just because of that. And that's all based on surveys done by the National Council of State Board of Nursing. So what have I been working on? Year number one. That's the next slide. So I've interviewed a lot of people. Some of you in this room have had the opportunity to be interviewed, just talking about what's going on in healthcare, what your position is, what are your challenges and barriers. So it helps me get some context for the work that I've been doing. I've been able to work with our academic institutions also to talk to them about why do we have declining enrollment, lack of faculty, clinical rotation. A nurse that's a master's prepared nurse makes a lot more in nursing than they do as a faculty. And so we're seeing those nurses that normally would have retired and gone into faculty just leaving healthcare altogether. So we have this lack of faculty within our academic partners as well. Been able to look at the current legislative landscape and regulatory agencies to understand the barriers there. One of our community colleges had a master's prepared nurse that they were going to put into a CNA leadership position to teach CNAs, and the State Board of Nursing didn't approve them because they didn't have any long-term care experience. So we have these artificial barriers that are set up with regards to that. And then testifying in legislation on behalf of the Health Sector Partnership. Last year, we had Senate Bill 226, which was Care Forward Act, which was amazing because we were able at zero cost to train CNAs and EMTs in our community colleges. And this year, we had House Bill 1246, which is called Career Advance, which now at zero cost will train for among many other things. But the thing I'm focused on is the registered nurse position. So I think it's an amazing program that we can support people in any demographic to go to school at zero cost to become a nurse. How amazing is that to have that pipeline? So now we just need to get some more faculty to train those that are interested in going into those programs. And then I've worked on healthcare workforce housing. So at the beginning of my role with the county, I brought together leadership from our two health systems and from our academic partners and said, here's what you've told me individually. Now let's talk about this globally. What should I be working on from your perspective? And they told me two things: retention and recruitment, and housing, which I had to laugh because I'm like, what can the county do about, your culture and your retention and engagement? So we'll talk a little bit about what we did with that. And then housing. So I did a little bit of research on workforce housing within healthcare. There are some health systems that do workforce housing, primarily in rural mountain communities, resort communities where it's just so exorbitant that they can't hire anybody. And as I worked with some of our local entities here along the Front Range, I've discovered in talking to our nurses, they don't want to work with each other for 12 hours and then go to the same building and live, like all live together and work together. So I didn't think that workforce housing would be some place where I would spend some time, but I did start looking at potentially some mortgage opportunities. So I have this great idea. Don't tell anybody. No, I've shopped it to a lot of different banking partners as well to do like a first responder education nurse mortgage, where they would have opportunities to apply for a mortgage that would be helpful maybe with PMI or down payment or other things. So right now, last year the legislation passed tax credits for businesses to help their employees with down payments, but it doesn't really apply to our healthcare partners because most of them are tax exempt. So how do we do something that's really thoughtful? Those areas that I just listed are really what I call the mushy middle, where they don't really qualify for some programs for housing. So how can we help? I've talked to principals of schools that said we have trouble recruiting because it's just too expensive. Our healthcare partners say we've had these wonderful travelers come in and say we'd love to stay in Colorado, but it's too expensive. We can't afford to live here. So how can we do something with the housing? I'm still working on that. I'm like a dog with a bone when it comes to a project, and I will talk to every bank in town until I find someone that will work with me on that, so.
Well, and I want to mention that it's interesting you mentioned that, Carol, because Commissioner Stevens and I both attended the National Association of Counties conference in Austin. And the National Association of Counties did a countrywide task force on housing, and they had some commissioners and they had a presentation, and they called it hero housing, actually. And so I was like, hero housing, so I kind of perked up my ears, but they were really focusing on trying to do dispatchers, teachers, nurses,
Yeah.
law enforcement, firefighters. And there is some toolbox and some ideas on the website, so I need to remind myself, I just pulled it up, and you can actually go and print out like things specific to Larimer County. And there were some interesting new stats, and I think I sent that to Leah. Did you get that? I had it sent in her office to you. I printed it out and sent it to you I brought it back from the conference. If not, I think I have another copy in my office. But it's very specific to each county. We could go and, put it in our
Okay.
county. But there was some ideas, and they called it hero housing. And so I know some other counties are doing this, and so let's see if we can find that and connect you with those folks, because it was something that certainly sparked my interest, and also the interest of some of the other Colorado commissioners that were there. And I'd like to see what we can do. We can learn from them, or, some ideas. And maybe if we had a countrywide or a statewide effort,
Sure.
we might find, I don't know, just might be an idea. So I'd love to explore that with you, so.
I appreciate that, and I do want to call out, thank you, Commissioner Stevens. I saw your name associated with Governor Polis's executive order on housing, so that's exactly what we need. So, thank you.
Commissioner Stevens.
Yeah, and I also want to add, well, I'll be serving on the Middle Income Housing Authority, and the Middle Income Housing Authority is specifically designed to look at the middle housing, and it's run out of the Economic Development versus the Department of Housing, so it is really concerned more with how do we keep and attract those essential workers that we need in our communities, so.
That's great.
As I haven't even been to my first meeting, or I would share something, but I will certainly share information as that comes forward.
That would be amazing, thank you. I'm encouraged to hear that, most certainly. So the second area was, no, go ahead, go back to that slide, because if you click on the let's take a look, that should be a link to my video. Oh, yep, there we go.
Okay, 1 second. Apologies. Please don't judge my taps. We're not getting any sound.
Oh,
Is it?
well, hopefully you all received the, that's all right, there's just a really great video on the Nursing Wellbeing Conference that we put on that addressed the retention and engagement. So how this came to be. Oh, maybe. Are we on?
Just go ahead.
Hello?
Hello?
Nope. Yes.
My red light's on too. I think it might be. Can you hear us in the office? I mean, up in the Chris?
Yes.
Okay.
Okay, great.
Can you hear Carol?
Yes.
Okay, thank you.
Wonderful, thank you. as part of the health sector partnership, we have a subcommittee that's a nursing consortium that looks at education and curriculum and nursing shortages and nursing in general. And a survey was sent out, and one of the things that they identified as one of the biggest challenges right now in nursing is well-being, that whole self-care piece of taking care of yourself and being the best nurse you can possibly be. So this was going on. The same time, I was meeting with some of our nursing partners and just talking about like what's going on in your industry and what are you thinking and feeling, and well-being just kept rising to the top. And then when our systems reached out and said retention and engagement, I recognized that this is something that we could potentially do through the health sector partnership. So we created our inaugural Nurse Wellbeing Conference. This was held February 2nd this year. It was a result of a planning committee of nurses throughout northern Colorado to really bring together ideas on what they could do for self-care and directing this towards nursing. The goal was to inspire, support, and honor our nurses. I wanted nurses of every discipline and system and entity attend so they would get some great tools and resources to take care of themselves so they can be better managers of their patients. We had over 150 nurses attend our first conference, which was amazing. Anywhere from student nurses to 40-year-plus veterans in the nursing world, from CNAs to LPNs to doctors of nurse practice. We offered contact hours, 5.5 contact hours for nurses who wanted to get use that for certification and renewals. And that gave us the opportunity to do surveys so we could assess if we were impactful and if it was meaningful. So 86% of the attendees agreed or strongly agreed that the teaching strategies enhanced their learning, and then also if they received tools and resources that would be helpful to them. So again, we gave some contact hours, and some of the comments that we had from our attendees. One of our nursing students said, "I will be graduating in May, and I will use these resources going forward as an RN. Thank you." Another one, which I love, "I will make my well-being a priority without guilt, as I now understand how and why it will improve my professional practice," which is really where we wanted to go. And then the last one was a text that I actually got that evening from one of our partners in Weld County who said, "One of my friends is a nurse and attended your event today. She loved every piece of the event, but her biggest takeaway was the message of the event. She was starting to get that burnt out feeling, and she walked away feeling completely motivated and re-energized. She is absolutely grateful for the opportunity to attend and wanted to thank those who planned it." So we know we had impact. We charged a minimal fee. It was $25 for nurses to attend, and many of them got scholarships through different programs and organizations. We also offered an opportunity for a $40 fee to provide a scholarship for a student nurse to come, and some people did that as well. So we really saw some generosity with that. So what did it look like? We began the day with our chief nursing officers from as many organizations as I could find come and stand up and thank the nurses for the work that they had been doing, particularly over the pandemic. We had our keynote speaker was Kathleen Flaherty, who's a brigadier general nurse, Afghanistan veteran, and gave some amazing tools and resources on trauma and combat, the things she learned through combat, and tools and resources for nurses. Some breakout sessions, tools and resources. We had CSU's Trauma and Resiliency Department come and give some tools and make everybody stand up and breathe. And then we had Dr. Brian Sexton from Duke University. He is the gentleman that came up with 3 good things. He spoke over Zoom and brought some great data, and then also gave all the nurses opportunity to access his data and his tools and resources. And then we ended the day with 3 patients coming up and thanking the nurses for saving their lives. So it was such an encouraging day for the nurses that attended. It just lifted them up, and I really wanted them to remember why they went into healthcare. I know it's been hard the last few years, but this is the reason why. So I'm like, well, good. I did what I said I was going to do, one and done, right? And then I had nurses coming up to me saying, "Can we be on your planning commission for next year? We have some ideas for speakers." And so we have this under the health sector partnership, this nursing consortium's like, yes, we've identified that again this year as a priority for well-being, so let's do it. So we're working on that for next year. Oh, one more, go back just for a second. I want to point out our sponsors. So it's not cheap to put on a presentation and a conference like that. So I've never worked so hard in asking for money in my life, but we had some great community partners. We had the cities and towns and chambers of commerce and foundations and universities and colleges and counties that all supported this work. And the nurses walked in and we had a big board that showed them the sponsors, and they were just kind of amazed because you notice our healthcare partners were not the primary funders of this. It was the community partners, and that was hugely impactful. Okay, so what am I working on this year? Oh, before I get into this year, because of this conference, we had Melissa Henry with University of Northern Colorado submitted this conference as an abstract for this state, the National Forum of State Nurse Workforce Centers, which was held in Washington, D.C. And we were accepted. So Melissa Henry and I went to Washington, D.C. and presented on this nursing conference and what we were doing, because it was, apparently it's innovative and unusual. So they said, we want you to come and talk about this. And it was so amazing to be able to lift up Larimer County, because they're like, wait, you work for a county and economic development. Like it was just unbelievable that there would be someone there. Mostly it was CNOs and different people from health systems and workforce centers, but to have to be able to lift up the county and how progressive Larimer County is, and this was really quite exciting. So what am I working on this year? Gig nursing. Gig nursing, I think, is going to be hugely disruptive, but it's going to be what our younger nurses are wanting, which is the ability to have flexible scheduling. Everybody's got their phones and their apps, right? And you can go in and let's schedule my own schedule on my app rather than somebody in a nursing office somewhere trying to get all these schedules right for the right amount of new nurse grads and experienced nurses and CNAs and LPNs. You have to have the right mix on every unit in any facility. And so to be able to see this being done through AI, through the scheduling through AI, and then the nurses in the driver's seat of their own schedules is going to keep that younger nurse, and because that's the flexibility that they're wanting. So I've actually been able to get a pilot program in one of our healthcare facilities here in Northern Colorado. It's about eight weeks in, so I'm not at liberty to talk about it just yet, but so far so good. Things have gone really well with them and they don't have any open shifts. Mercy Health in Ohio implemented gig nursing, and it saved them $5 million the first year, and it pretty much reduced their travelers to almost nothing because nurses were in the driver's seat. They picked the schedules they wanted to work. I want to re-engage nurses that have left, either retiring early or have left just because it's not flexible. So I've done some focus groups and talked to them about, like, why did you retire? And part of it is that not feeling valued. The work that they did was not valued, and the lack of flexibility. So I know we're on the right track. Also working with our K-12 partners in promoting that workforce pipeline. Sadly, the numbers are declining for people going into nursing. There used to be like 300 people trying to get 30 slots, and now we're not seeing that number of people going into nursing. So how do we re-engage our students with that? And then working on opportunity now funding through the health sector partnership. Okay, some of the groups that I'm involved with, I love being a non-nurse on the nursing advisory boards of Front Range Community College and UNC, because I bring a different perspective, and they love having somebody there that is outside of their academic nursing world to have that perspective. I'm working on some state and national nursing initiatives through the Colorado Center for Nursing Excellence and on their advisory board. Working with work-based learning, leadership groups with the health sector partnership. I'm just recently on the Colorado Hospital Association Healthcare Workforce Coalition. So they're looking at that from the hospital setting. And then NCLA, our legislative alliance, always looking at what's going on with healthcare. And then last year, I completed the Leadership PSD class, which was wonderful because it really gave me some good connections with the school districts and what we're doing. So why are we doing this? Again, declining volume of applicants to nursing programs, challenges with lack of faculty and resources, challenges with clinical placement of student nurses, and I could talk about online programs that you can become a nurse, but there's nowhere to do your clinical because nobody knows who Post University is or whoever it is that where they're taking these classes. So that's another barrier. And then increased acts of violence and abuse towards healthcare professionals. That's going to be one of our sessions at our nursing conference next year because we need to shine the spotlight on that and give the tools and resources for nurses to be able to do something about that. I see you're ready to ask a question.
Well, that's a topic that, I've been bringing up for the last 2 to 3 years. Because, I've talked with nurses who experience violence in the workplace, and it is on the rise. And so that was a conversation I had with some state legislators about how can we, look at the legislative fix, because a lot of them felt they didn't have rights to defend themselves. So I've been having those conversations, and then I kind of backed off because I saw that some of the hospital systems, and I saw that there was a bunch of things coming out online and I saw some of the hospital leaders talking about it, and I thought maybe that was rolling in the right direction. And it was like everywhere I would pop up, of course, I get a lot of medical journals and stuff that we're talking about this, and it's also to physicians and clerk. I mean, it's everyone working in the hospital. So I'm curious, where's that at? I mean, because we know that maybe nationally or at the statewide, is it something we need to advocate for with our partners? Hey, can we look at this and how can we fix it? Because I'm not sure legislators are hearing that message. We know we did the code protection officer bill when we did, was Amy around? We did that bill and we added the healthcare professionals onto that because nurses were being, targeted. And so that was a really opportunity time, and hearing some of the nurses' stories. And now I've been hearing these acts of violence all kinds of things. I don't want to go into all the details because it's pretty, tremendous to what they're going through, or not tremendous, horrible. So I'm just curious where that's at and where can we kind of help support that?
I think we still need to shine the spotlight on it because nurses and healthcare providers will, I wouldn't say justify it, but they excuse it because somebody's on medication or this is a bad day for them, and they think, well, this is how you're going to act if you're sick and you don't feel well. But we have to empower nurses to report these, and many of them don't even report them to their supervisors, let alone law enforcement. So we are going to bring that element into our conference next year because they need to know that they do have resources to report these without fear of retribution or getting in trouble for saying that somebody kicked me or this or that. So I think we do need to keep that spotlight on there, most certainly.
Yeah, I mean, I'm glad to hear that. I still think we need to look at the legislative thing to make them feel like they're protected, because, this is like choking and being, hit in the face and all kinds of things. So I think this is something also to kind of look at. So I'd love to maybe follow up with you offline to continue that conversation.
Absolutely.
So is that?
I'm pretty much done.
Okay,
Yep.
so colleagues, Commissioner Cavalli, any questions or comments?
Yes, I do. Regarding the, going back to the earlier part of your presentation, Carolyn, and thank you for the good work. Excellent, well done.
Thank you.
On the recruitment and retention, I seem to recall, I don't remember if it was pre-COVID or during COVID, that the Fort Collins Chamber of Commerce, in conjunction with, I think, our Economic and Workforce Development Department, worked on some kind of a software that was able to look at regions around the country and look where there were shortages and do some kind of targeted recruitment. Am I remembering right? And if so, what is the status of that tool?
Well, Evan, you might come up, but I know one of my peers, Andrew Miner, does a lot of research with that, and we used to have software where we could see where there was an excess of nurses. And what I do now, similar to what you do, I get a lot of journals, medical journals and medical news, and I can see like who's laying off nurses, and I just shoot out a email to people like, hey, they're laying off 80 nurses in Texas.
But I'm wondering about, I thought it was a state-of-the-art kind of tool that we were using or could be using.
No, absolutely. You're remembering correctly. So through the state, we were provided, at the time, it was Lightcast or EMSI. The state has decided to go a different direction this year. So now we are using Chmura Jobs EQ.
Say that again?
Chmura Jobs EQ, which provides us similar data, but not to the same extent that we were getting from the Lightcast EMSI service. So we are still tracking, but not to the same extent that we can identify where there are surpluses or extreme shortfalls because of the technology change at the state's level.
Okay. May I continue? Regarding the workforce housing matter, are you aware of one of the down payment assistance programs, the Metro DPA, Metro Down Payment Assistance, which, because of a decision we made a couple of years ago, we can use that here in Larimer County, the Metro Down Payment Assistance Program.
I'm not aware of that, but thank you
I
for
wish to
letting
bring
me know
that to your
about that.
attention.
Okay.
And I think just two more questions regarding UC Health, the UC Health system and their responsibility to provide community benefits. Has there ever been discussion about whether or not providing dollars for down payment assistance or some type of appropriate workforce housing could be construed as a community benefit?
UC Health is the healthcare entity that is building workforce housing up in Steamboat, so they are aware of that. And many nurses, when they are new to an organization, will get a fairly large sign-on bonus. So sometimes they use that for, because I've talked to both of our health systems about that, and they're like, well, they get pretty good sign-on bonuses. So if they need help with down payments, that's how they
Okay.
deal with that.
Then my last question is regarding these categories of nurses, traveling nurses, public health nurses, psychiatric nurses, and then nurses who participate in the nurse-family partnership. Are we seeing issues with finding folks to meet those needs?
Well, with traveling nurses, that entity of nurse is actually softening. So we're seeing fewer health systems using fewer traveling nurses. It doesn't mean that the need has gone away, but the salaries are so exorbitant that it's just cost prohibitive to continue to use them. So they're really working on their staffing ratios right now, which is also an issue. With public health nurses, we're fully staffed. Tom, I reached out to one of your folks recently because they'd reached out to me saying, do you have any, people call me like, hey, do you have a nurse? So it's like I have them in my back pocket, but they are fully staffed right now. We're doing okay in that area. Behavioral health, it's interesting. I ran a Zello report, which is the school report for like where kids want to go into. They fill this out in middle school, and so it helps them with high school to get into the right tracks. More students wanted to go into behavioral health nursing than regular nursing, so I'm very encouraged by that. I think we will start to see movement in that. The nurse-family partnership, I'm not familiar with that, so I can't respond to that. So.
Yeah, I would think that that's one type of nursing where the nurses would be happy because they provide support to new parents,
Okay,
0 to 2 years old.
yes.
I think that would fall into some of the case management-oriented nursing
Okay.
that you talked about being
Yes,
one of the
yes, the
categories
happiest
of
nurse,
the
yes.
happiest ones.
Yes.
I think that would fall
Great.
into that bucket,
Thank you
sir.
very much
Yep.
for answering my questions. Thank you, Evan.
Thank you.
Commissioner Stevens.
Yeah, we're only on till 3 and we have one more.
Yeah, I was gonna
item.
encourage
So
that we
I
keep up
love
on
the
this
work
one,
that you're
please.
doing, Carol. Thank you for the presentation. I would say keep up the good work.
Thank you.
Fantastic presentation, Carol. Well done, as always. Thank you very much. It's great to see.
It's my pleasure.
And thank you, Evan and Caitlin, for the assist.
Thank you. Thank you.
Thank you. So our last presentation, and I know at least one of the commissioners, actually all three, but one of the commissioners that I've worked with for a long time on issues around this population, so maybe the one with the most tenure at the table, I know will be particularly excited about this development. So through some additional funding that was secured through the Economic and Workforce Development Department, we were able to get funding to support a disability program navigator within that team. And so Marcy Kasner, who is our Workforce Connections Manager, I'll have her actually introduce Blake. Blake is the newest member of our team in the Economic and Workforce Development Department, and they're going to talk about the work that she's going to be doing in this space.
Good
Welcome.
afternoon. Thank you. Good afternoon. I'm Marcy Kasner. I'm one of the team managers. The two teams I support are the Workforce Connections team, and that's both general job seekers and business services, and then also the Veterans Service Office. So nice to be here this afternoon. And I just have to say, those two programs we just heard about, they're just so inspiring. I'm really impressed. So, but we're really excited to talk about the DPN, or the Disability Program Navigator position. You may not know this, but about 20 years ago, we had this position as well through a grant, and then it ceased. And so now we are able to bring it back again. And the first thing that I wanted to explain was, why are we doing this again? And part of the reason is because of this statistic. And I think, it's historical. Before COVID, when I was looking at the data for folks that are disabled and what their unemployment rate looks like, it was really high. It was like 17.9%. It has dropped, as you can see, but we also have a labor shortage, and so I do think that's part of the reason for the drop. But the other thing to know about the unemployment rate is this does not take into account people who have left the workforce, that they've just decided they're not going to look anymore. So what we could be seeing here, some people, and we know that happened after COVID, that people just didn't come back to the workforce. So we've got a low unemployment rate, but as you can see, folks with disabilities have twice the unemployment rate. So and then the interesting statistic I also saw at Bureau of Labor Statistics was this, that they're more likely to be working in service occupations. And a lot of times those are not occupations that are going to lead to upward mobility. So that's why we felt strongly about bringing back this position. We got funding, and you'll see that in a minute. But I'm going to turn it over now to Blake to introduce herself.
Hi, I'm Blake Dowling. I'm the Disability Program Navigator for Economic and Workforce Development. I started working here at the very end of March, so it's all kind of new to me, learning about the workforce and getting out into the community and working with different resources in the community that serve people with disabilities. Previous to this position, I worked for Mosaic, which is a program-approved service agency serving people with disabilities. And I then got into the skilled nursing home field and worked as a social service director, and then moved into an administrator role at a nursing home in Berthoud. So, and then I stayed home with my children for 8 years, and then decided it was time to come back and get back into the workforce, and applied for this job, and fortunately got it. So thanks for having me.
It's been a huge learning curve because Blake doesn't have the background of the workforce system, but yet was, part of this role is being kind of the go-between between Division of Vocational Rehab and our office. So learning a lot about our office, and then also at the same time learning or relearning maybe about DVR. So the position is funded, like I said, the majority of it comes from the Division of Voc Rehab. And again, if you're not familiar, they do now operate under the Colorado Department of Labor and Employment. So they're another strand along with us. And then 25% from our budget. Well, there are lots of goals, actually. I won't go into each one of them, but, obviously because of our, work as economic and workforce development, getting people employed is critical. So that's really, ultimately, when you boil it all down, that's really what we want, is people to get employed. More people who have disabilities getting meaningful employment in the workforce. But the other thing that came out of this, because it's also funded by DVR, they really do want to see more of that partnership. And I think we're headed in a really good direction, because one of the things that Blake and I've spent a lot of time talking about is it has been challenging. And again, I don't know how much of this you're familiar with, but getting people timely into DVR and through that process it's cumbersome. It's just, they have very different timeframes than we do, so we operate it very, they have to get medical documentation and all that together. We're ready to try and get people out as quickly as we can, training, paid internships, and then on to employment. So they're just very different in that. And so what happens a lot is our people get bottlenecked. And one of the calls that I took the other day when we were at a staff retreat, a customer called and he was really frustrated because he'd gotten to DVR, he'd gotten a counselor signed, they were going to reassign him because caseloads there are very high, so they were shuffling him. And all he really needed was what we are calling a work skills assessment. So he knows with his disability what he can do. That's all he wanted. So Blake and I sat down and started talking. It's like, if you've got a bit of a budget, why don't we see if we can contract that service so that we can help them get that done and move them a little bit quicker instead of having to wait till they can get to DVR, get an appointment, get their counselor signed, potentially reassigned, and then we can move them forward. And so Mark, who is not here, who wishes he was, well, kind of, he's got a kiddo that's going to college, so, but you know, what we're trying to do then is, can we bypass some of that service that's the only thing they needed from DVR? And can we help do that? And so we're going to move forward with that. You want to talk a little bit about who you've talked to already?
Sure. I spoke with CSU about the different things that they do as far as job coaching goes and skills assessments. And so I just spoke with them last week and waiting just to hear back on pricing for that. So if we would contract with them, what that would cost, and then our ability to provide that service through them to some of our customers. Also, just spoke with Sample Support, and they provide supports to people with intellectual and developmental disabilities, and they provide that service currently for people that are within their program. But they have in the past, and they are willing to contract with us to provide that service as well. So that would be the job coaching and doing skills assessments.
So again, a little bit quicker, and what we hope it also helps is our partners at DVR, so they're not so backlogged, if we can take some of that off of their caseload. So we're pretty excited about that. If you want to go to the activities, Caitlin, that would be great. So there's several things that Blake has already been involved in, but one of the things is just being out in the community and doing some community mapping for us to what services are out there. Because at Economic and Workforce Development, we are not experts at that. We rely a lot on our DVR partners, and again, with them being so having time constraints with their caseloads, it's just so much easier to get someone that's on our team to go out and, could you look at this for us? Could you take a look at this service? And so we're going to create a community map, basically, of all the services for folks with different disabilities. It's interesting to note, too, that when we talk with our partners at DVR, 80% of the folks they're serving at DVR, it's mental health issues that are their disabilities. And we certainly, work with that all the time. Really, where we're learning a lot more with Blake being in the community are things like folks with low hearing or low vision, physical disabilities, intellectually and developmental disabilities. Those are the kinds of things that Blake's really going out and getting for us and bringing back. So we look forward to even more. Some of the things that Blake has done more recently has been we've never been able to do this service. Somebody's going to apply for Division of Voc Rehab Services. There's an intake process. Blake actually can now go with them. So they start in our office. Blake, how many of those?
I've done 2 so far.
Yeah.
Yeah.
And so all the staff know, if you've got somebody you're working with, they feel pretty connected to us, but they don't necessarily feel connected to DVR yet. Blake could meet them here and then meet them over there. Yeah. So anything else you'd like to say about some of the success you've had already?
I think just getting out into the community, and it's been interesting for me just to get out into the community and talk with different resources that support people with disabilities, to find out that they really don't have a lot of knowledge about what's going on at Economic and Workforce Development. And so to be able to educate a little bit about what's going on here has been helpful. And then just, obviously to learn more about the different services that they provide, and then bring that back to the workforce staff. Been able to let them know about different opportunities for people out in the community. So I think that's been helpful for me and the community and also our staff.
Mm-hmm. One thing I did also want to bring up is the bullet in the middle there, accessibility review team. We created that last February. We started before Blake started. And what that's intended to do is help our customers who have, well, we want to be universally accessible to anybody, right? But really what we concentrated on in this group are people with disabilities and people with language barriers that are customers. And so we started that group, we call it the ART team, everything's an acronym. We call it the ART team, it's Accessibility Review Team, and now Blake oversees that, and we'll move that along and forward, and we meet quarterly. We pull all the team leads together, from the Veterans Service Office to, all the teams that we have upstairs, and we just ask them to tell us kind of what's going on with their customers that we may not be realizing is an issue for them to get our services easily or readily. So that's underway. Blake's done her first meeting with that one as well. So, yeah. And then, let's see, measuring outcomes, yeah. So a lot of the outcomes are measured, well, customer satisfaction surveys, because that came down from the state in this program that they wanted that. But then the last bullet there, those are the same performance measures that WIOA Title I and Title III. Title III is the one that I work with. Title I, WIOA, Workforce Innovation Opportunity Act, sorry. That one is our training program for dislocated workers, and those measurements are all the same. So they're going to pull the same kind of performance measures for the folks that get put into this program to see how we meet those measures. And as you can see, entered employment's going to be the primary one, so. Yeah, and I'm thinking that, yeah, we'd love to hear if you've got questions or comments.
Well, welcome, Blake. It's super exciting already, just such an impact. Thank you for being here today, and it's really nice to meet you. And I really like the idea that you're accompanying folks as they're, going to this, to navigate. I always love hearing about navigators. I see them throughout our system, but it's just, they're so important. So just want to say, great presentation. I have a few other comments, but I'll see, Commissioner Stevens, do you have any comments or questions?
Yeah, I don't think I have any questions, but I just appreciate the work that you're doing, and you haven't been here that long, so that's remarkable that you've made all those connections, and I think obviously this is really important as we want to make sure that everybody has meaningful work, as you said, and so knowing that those unemployment rates are higher for people with disabilities, we just want to make sure that everybody has the opportunity to work and to find work that is meaningful. So it's interesting that we haven't really seen people with the mental health kind of disabilities that maybe we're seeing throughout the state. Is that what you're saying, that there's more people with?
I would say that our caseloads right now with WIOA Title I, our training one, and also our Wagner-Pizer, which is the Workforce Connections team, I would say we see a fair share of folks that have some mental health issues,
Okay.
yeah. I don't know that they offer that up, but, when you've visited with them repeatedly, you start to see some patterns.
Right.
But again, right now, the labor shortage is so critical that this is a great time to try and pull people that have left the workforce back into the workforce, no matter what, is going on. If we can get people stabilized and get them accommodations, this is a great time to get back in.
Exactly, and I think, I imagine that employers are more open to that
Absolutely.
as they struggle with finding a
Absolutely.
workforce.
Yeah.
So this is a great time to have this position in place. Glad that we have some funding from the state to do this. But yeah, I love the work that you're doing, and keep us up to date.
Thank you.
Thank you, Commissioner Stevens. Commissioner Kafas, do you have any comments or questions?
Yes, I do. First of all, welcome, Blake. Thank you, Marcy. Couple of questions related to, are you working with, for example, the Colorado Office of Employment First at the state level?
Not that I'm aware of. I know which program you're talking about.
I would maybe take note of that, because they are the ones that, they work with Division of Voc Rehab and others to look at, focusing on employment first. So the Colorado Office of Employment First. A second question is one of the services you provide is to help people navigate, oftentimes people who are on SSI or I think it's SSI, that's income-based. How do you help folks know how much money they can make before they're at risk of losing their SSI?
So that is actually something that, I'm just going to pull up my little notes here so I can remember what the training is that I'm going to be going through. But I am scheduled to go through a training starting in September, and it's through VCU Work Incentive Planning and Assistance National Training Center. And so that they're just, basically is training on benefits and how the system works. The other piece that I can assist with is, there is a website, Colorado DB 101, that just has some information on there. And then also just trying to help connect people with people in the community that can help walk them through some of that as well.
And Commissioner Kafalis, I just talked with a staff person today that came to our office from Social Security Administration and asked if he would talk with a former colleague about how they get to be a certified planner. And so he's going to connect us and see if we can learn a little bit more about how they do that.
And just to wrap up for me, it's good that you're working with Colorado State University and the Center for Community Partnerships. Their occupational therapy program and others are really instrumental. I'm wondering, are you working with such groups as the ARC of Larimer County, Spirit Crossing Clubhouse, and also our friends at Foothills Gateway?
Yes, so the first community outreach I did was to the ARC of Larimer County, worked with them or talked with them about the different programs that we have, and actually I received a referral from them about, I think it was the end of July that I received a referral from them and have been working with that client. So, and then Foothills Gateway, I've done a little webinar with Foothills Gateway. I used to work not for Foothills Gateway, but with Foothills Gateway when I worked at Mosaic. So, so I do have some knowledge of that program. And then I can't remember the other one. that you
Spirit
mentioned.
Crossing
Yep.
Clubhouse.
Yes, Spirit Crossing, yeah, I did. I visited there. They have a really amazing program there. And yeah, have made a referral to them. It goes through Summit Stone, but made a referral using Summit Stone to have someone
Great,
visit there.
thank you. My last question is, I know this is, your position is, you just started 6 months ago. Will you be tracking the kinds of jobs that our folks are placed in, especially people with intellectual and developmental disabilities, what kind of jobs they get in, and what kind of wages they make?
Yes.
You will?
Yes, that's actually part of it, is trying to get what we're calling meaningful employment.
Yes,
Not-
yeah.
Yeah.
So I would look forward to the next time we update, maybe
Yeah.
if there's any data, that it would be great to know what kind of jobs folks are getting and,
Absolutely.
what kind of meaningful employment they're securing.
And Commissioner Kafalis, could I just respond again to the Spirit Crossing question? We do actually have another staff member who's not here, who's on the board now. Yeah.
Excellent,
Yeah.
great. Thank you,
Thank you.
everyone, for allowing me to ask questions.
Well, we're out of time. I had a couple others, but I'll just have to maybe see if I can ask Evan if I can reach out to Marcy and Blake to maybe ask questions down the road, because I want to honor everyone's time, and it seems we always have more questions, we have time. So, but once again, I want to welcome you, Blake, and thank you, Marcy, for being here. This is really exciting to hear, and I look forward to hearing all the other great impacts you're making. Just want to give a chance to Lorinda to add anything, because again, I saw you taking lots of notes too.
I did. Just briefly, I think these are 3 programs that were identified to highlight today that really address community needs, 3 very different community needs. This service area is very broad, and the kind of things that they do, you see cross from employment and economic development to helping people with special needs to community needs and housing. Thank you, Laura, for thinking of these to highlight. I think it's really important to the community that we talk about this work, because I think it's invisible if we don't talk about it. So thanks for your creativity, for all that you do, and for seeing a problem and looking for a solution.
Okay, well, great job, everyone. Fantastic presentations. Really excited about all the information today. So thank you all. Have a great week. And at 3 o'clock, we are adjourned. Have a great day.